Canine Spay. Ovariohysterectomy, commonly called a spay, in the dog is one of the most frequently performed surgeries in veterinary medicine. The primary reasons for the spay is to prevent disagreeable estrus or heat cycles from occurring, as well as to avoid unwanted pregnancies. A responsible pet owner will usually opt for this procedure to help in reducing pet overpopulation. There are many medical reasons to have a spay performed, such as to help reduce incidences of mammary tumors, as well as prevention of uterine infections and uterine cancers. Your veterinarian will guide you as to the most appropriate age that your dog should have this procedure. It should be pointed out that the common misconception that this procedure will alter your dog's personality is false. After a complete physical examination and pre-surgical blood tests, your pet will be fully anesthetized and given pre-surgical pain medications for the procedure. The veterinarian and veterinary technician will closely monitor your dog using special equipment throughout anesthesia. During the standard procedure, your veterinarian will remove the uterus and ovaries using careful surgical techniques. After incisions through the skin and into the abdomen are made, a special instrument, known as an ovariohysterectomy hook, is placed in the abdomen near the area of the left kidney. The left uterine horn and then the left ovary are identified and gently elevated from the abdomen. Surgical forceps are strategically placed between the ovary and the kidney on the ovarian artery and veins. A ligature suture of an absorbable material or stainless steel clip is placed on the blood vessels to prevent bleeding. The left uterine horn is then followed down the tract to the cervix of the uterus, where the right uterine body is identified and elevated from the abdomen to trace to the right ovary. The same forceps and ligature procedure is performed as described for the other ovary. The uterine body is then elevated and surgical forceps are placed below the body of the uterus and above the cervix. Then ligature sutures or stainless steel clips are firmly attached to the uterine arteries and veins. If the patient is in estrus or pregnant, additional special care is taken to prevent any bleeding. Closure of the abdomen includes the muscular wall layer of the abdominal wall, the subcutaneous tissue, and the skin sutures. Following surgery, your veterinarian will instruct you on post-operative care. This usually involves limited activity for a few days following this surgery, care and observation of the surgical site, administration of pain medications, and returning to the practice for a suture removal 10 to 14 days following the procedure. Providing your dog with fresh water and a warm, comfortable place to rest following the surgery is important. Your veterinarian will inform you on when to feed your dog, and it is not unusual for your dog's appetite to be suppressed for several hours after surgery. If a normal appetite does not resume, or if you notice any swelling, discharge, or bleeding from the surgical site, please contact your veterinarian immediately. Some dogs may experience weight gain following this procedure due to hormonal variation. Your veterinarian will instruct you on the ideal nutrition for your dog to avoid obesity. It is not unusual for your dog to have a mild cough for 2 to 3 days following the surgery. Slight irritation to the trachea from the endotracheal tube used during surgery can cause this. If the cough persists, please contact your veterinarian. Some dogs may lick and chew at the surgical site. This can cause irritation and may lead to the sutures being pulled out. Your veterinarian can offer products that deter your dog from chewing and may also recommend that you use an Elizabethan collar to prevent further chewing. This concludes our brief overview on the canine spay procedure. For further information or questions, please consult with your veterinarian.